learners online and here in PRTV 12. Today, I invite you to embark on an essential learning that will surely serve you well. I am Teacher Jerry and I am happy to be your learning facilitator for this session. Health is wealth. This is a common saying we often hear. Hence, it is very much important for us to identify what health resources and facilities we have in our respective communities. As we go through this session, we will focus on this objective. Are you ready? Let's assess your prior knowledge. Go to pages 2 and 3 of your module and we will process the pretest. Use your notebook to write your answers and write the letter that corresponds to the correct answer of the given situation. We begin after this sound. Marisol is pregnant and must consult a medical professional. What kind of doctor should she seek? Is having difficulty in urinating. He is starting to experience edema. Whom must he consult? John is a 1-year-old baby and he has 3 days fever. What kind of doctor should he seek on his checkup? Lala broke her leg after a motorcycle accident. An emergency operation is needed. Who must work on her case? What do you call a qualified person who delivers proper health care to an individual in need of healthcare services? Healthcare professionals are blank. The following statements are all correct, except what do you call a doctor that specializes in women's health? Gastroenterologists are specialists in, except cardiologists are experts on the blank. Did you get all the correct answers? If yes, excellent. If not, be attentive as you go over this lesson so that you will get all the correct answers later. In your previous module, you learned about the procedures in health appraisal and its importance. Health appraisal procedure is a procedure to determine the health status of the students. Health appraisal needs to be implemented in school for a series of procedures to assess or determine the health status of the students through the use of teachers' observations, screening tests, health histories or inventories, medical and dental inspection, and psychological tests. Kids, Let's check if you still remember the 3 health appraisal procedures mentioned in your previous module. Identify the following health appraisal procedures. First, blank determines the potential health implications of the policy. Second, this is where the key health issues and public concerns are identified that should be considered in the assessment. Third, this is the procedure in which the evidence is gathered and is used to estimate the potential health gains and losses. Were you able to answer all the items correctly? Good job, kids! This time, let us be familiar about community health. Community health is the status of a defined group of people and the actions and conditions to promote, protect, and preserve their health. Community health services cover cradle-to-grave services that many of us take for granted. They provide a wide range of care, from supporting patients, managing long-term conditions, to treating those who are seriously ill with complex conditions. These services are made possible through health professionals and healthcare providers. A health professional is a qualified person who delivers proper healthcare in a systematic way to any individual in need of healthcare services. A healthcare provider may refer to a health professional or an organization that provides professional health services. Now, guess if you know the following health specialists. Write your answers in your notebook.
Wait, kids! This is your Kuya Jabi. Can you help me solve this puzzle? Great! Every time you answer an item correctly, we get 1 puzzle piece. Let's start! Great job! Very good! Nice! Well done! Nice going! That's right! Almost there! Excellent! Good job, kids! You helped me solve this puzzle. Well, gotta go. Teacher Jerry is already waiting for you.
Did you get all the correct answers? If yes, great! If not, continue to be attentive in this learning session. Based on the pictures shown, what are services rendered by the health professionals? That's right! Those health professionals provide varied treatments. For example, eye problems are treated by an ophthalmologist. A pregnant woman is taken care of by an OB/GYN or gynecologist. A child is checked by a pediatrician. These are just some of the varied services that health professionals can provide. Most commonly, these health professionals are referred to as doctors, but most doctors have extra expertise in one type of medicine or another. Here are the most common types of doctors you'll likely see. Cardiologists. They are experts on the heart and blood vessels. You might see them for heart failure, a heart attack, high blood pressure, or an irregular heartbeat. Dermatologists. Have problems with your skin, hair and nails? Do you have moles, scars, acne, or skin allergies? Dermatologists can help you. Gastroenterologists. They're specialists in digestive organs, including the stomach, bowels, pancreas, liver, and gallbladder. You might see them for abdominal pain, ulcers, diarrhea, jaundice, or cancers in your digestive organs. They also do a colonoscopy and other tests for colon cancer. Geriatric medicine specialists. These doctors care for the elderly. They can treat people in their homes, doctors' offices, nursing homes, assisted living centers, and hospitals. Pediatricians. They take care of younger patients from infancy through age 18 or, in some cases, age 21. Gynecologists or OB/GYN. They specialize in women's health, including reproductive health. These doctors provide women with preventive care, manage pregnancy, labor, and delivery, and diagnose and treat diseases of the reproductive organs. They also specialize in women's health issues like menopause, hormone problems, contraception, and fertility. Surgeons. They can be trained in general surgery or in more specialized areas of surgery, such as hand surgery, surgical oncology, or vascular surgery. Psychiatrists. They specialize in mental health and treat emotional and behavioral problems through a combination of personal counseling or psychotherapy, psychoanalysis, hospitalization, and medication. Ophthalmologists. They are medical doctors who treat diseases or disorders in the eyes, such as cataracts and glaucoma. They also perform eye surgery when necessary. Vision correction that cannot be handled by an optometrist may be treated by an ophthalmologist. Pulmonologists. They treat the cardiopulmonary system, which consists of the organs, including the lungs and heart, that work together to help a person breathe. Neurologists. They are doctors who take care of patients with medical conditions that affect the brain, spine, or nerves. Neurologists see patients who have complex medical disorders such as Parkinson's disease, multiple sclerosis, and neuropathy. They also take care of patients who have common problems such as migraine, headache, and dizziness. Nephrologists. They treat kidney disease and prescribe dialysis for experiencing kidney failure. Urologists. They diagnose and treat diseases of the urinary tract in both men and women. They also diagnose and treat anything involving the reproductive tract in man. Urologists treat all parts of the male reproductive system. This system is made up of penis, prostate, and testicle. Physical therapists. They rehabilitate persons with strength, mobility, and other muscular disorders. It is best to know what specialists you need hand in hand with a health concern that you or family member is suffering from. As always, it pays to be knowledgeable about various things, especially about health. What about community health facilities? Community Health Center. Health centers are community-based and patient-directed organizations that deliver comprehensive, culturally competent, high-quality primary health care services. Health centers also often integrate access to pharmacy, mental health, substance use disorder, and oral health services in areas where economic, geographic, or cultural barriers limit access to affordable healthcare services. School clinic. This is a place within the school campus wherein primary care is rendered to a sick patient. First aid and initial nursing assessments are given during emergent situations. The primary purpose of the School Health Services program is to promote the physical and emotional health of students and staff, thereby maximizing the educational process and work functionality. Now, we just walked through the necessary know-how about community health services and facilities. Let's assess what you've learned. Let's start. Match the type of the physician with his or her area of specialization. Write your answer on your notebook. Did you get all the correct answers this time? What is your score? If you got 6, excellent. If 3 to 5, good. 2 and below, cheer up. You can do better in our next activity. This time, choose the medical specialist described in the statements given. Write your answers in your notebook. 1. Treats persons with cardiac problems. 2. Treats persons with urinary kidney disorder. 3. Treats persons with dental problems. 4. Treats persons with problems in the skin. 5. Rehabilitates persons with strength, mobility, and other muscular disorders. 6. At birth, baby Mika must have her own medical specialist to monitor her growth and development. Who should her parents consult? 7. While playing, Jerome accidentally hit his head on the floor. He was unconscious and was rushed to the hospital, where it was found that he suffered a blood clot. Who should attend to him? Myrna's pregnancy is at high risk and must consult a medical professional. What kind of doctor should she seek? Nine, they treat the cardiopulmonary system. 10. A qualified person who delivers proper health care in a systematic way to any individual in need of healthcare services. How are you doing so far? I hope you're getting all the correct answers. Your assessment score tells your understanding of the lesson. To fully know your grasp of the concepts presented in this module, let's move to your post-test. Read the questions carefully and write the letter of the correct answer in your notebook. Ready? Let's begin! What do you call a doctor who takes care of patients with medical conditions that affect the brain, spine, or nerves? Joanne's pregnancy is sensitive and must consult a medical professional. What kind of doctor should she seek? His leg after a vehicular accident. An emergency operation is needed. What kind of doctor should work on his case? What health issues an OB/GYN specializes? What do you call a health practitioner who performs eye surgery when necessary? What do you call a state of complete emotional and physical well-being? Prescribe dialysis for experiencing kidney failure. Who diagnoses and treats diseases of the urinary tract in both men and women? Rehabilitates persons with strength mobility and other muscular disorder. Who treats persons with dental problems? Kids, this time, compare your scores during our pre-test hand in hand with your post-test. An increase of your score shows that you learned well in this session. If it shows a decrease, don't worry. You may watch this video lesson again in our YouTube channel. Search Aral TV Deped Leyte. Click subscribe and hit the notification bell to get the latest updates. In this age where technology reigns, there is no limit to worthwhile learning. Your only obstacle is your attitude towards learning. Again, this is Teacher Jerry saying stay healthy and keep safe always.